Have you ever noticed that after a long period without intimacy, you begin to wonder if your body has quietly changed? Maybe you feel normal in every other way, but a question keeps coming back to your mind. Am I still functioning the way I should? Many men think about this, especially after the age of 50, but few feel comfortable asking. I'm Dr. Ross, and today we're going to have an honest conversation about what science tells us. If you've gone weeks, months, or even years without sexual activity, I want you to know that you're not unusual. Life changes, health changes, relationships change. Sometimes work, stress, grief, or caring for a loved one pushes intimacy into the background. Before we begin, I'd like to hear from you. How old are you? And has this topic ever crossed your mind? Leave your age in the comments if you're comfortable sharing. I read as many comments as I can because your questions often inspire future videos. If you want more practical health tips based on medical knowledge, join the channel by subscribing and don't forget to like this video. Every new subscriber helps us reach more people who are looking for trusted health information. One of the biggest mistakes I see is that men assume the body works like an on and off switch. They believe that if sexual activity stops for a while, everything suddenly stops working too. That simply isn't how the male body works. Over the years, I've noticed that many of my patients arrive feeling worried because they've heard frightening claims online. Some believe they have permanently damaged themselves. Others think they have lost their masculinity forever. Most of the time, neither of those fears is true. Your body is designed to adjust. It responds to changes in your daily life. Sometimes those adjustments are noticeable. Sometimes they are so small that you never realize they happened. Understanding the difference between a normal change and a medical problem is what gives you peace of mind. To understand this better, let's first look at what keeps the male reproductive system healthy. There are three important things working together behind the scenes. The first is healthy blood circulation. The second is strong muscles in the pelvis. The third is balanced hormones, especially testosterone. When these three systems work well together, they support erections, bladder control, sexual desire, and overall pelvic health. Let's start with blood flow, because everything begins there. An erection happens when blood fills special tissue inside the penis. That blood brings oxygen and nutrients. You can think of oxygen-rich blood as fresh fuel delivered to living tissue. Without good circulation, tissues throughout the body slowly become less healthy. The penis is no different. Many men are surprised when I explain that your body performs some of this maintenance automatically. Healthy men usually experience erections during sleep. These are not caused by sexual thoughts. They are simply part of normal body function. Nighttime erections help keep the tissue supplied with fresh blood on a regular basis. If those natural erections continue, even during a period without sexual activity, your body is still doing part of its maintenance work. So what happens during a long period without intimacy? The answer is not that everything suddenly fails. Instead, some men notice gradual changes. For example, the first erection after a long break might not feel exactly the same as before. It might take a little longer. It might not feel as firm initially. This often causes panic. In many cases, this response is temporary. Once regular blood flow returns through normal erections and sexual activity, the tissue often responds better again. The body is adaptable. This is why I encourage men not to jump to the worst conclusion after one disappointing experience. One event does not diagnose erectile dysfunction. Many factors affect erections on any given day. Stress, poor sleep, alcohol, certain medications, anxiety, and even dehydration all influence blood flow. In my clinic, I've often met men who were convinced something serious had happened after one unsuccessful attempt. After we talked through their recent stress, lack of sleep, or changes in medication, the picture became much clearer. Now let's move to another part of the body that many people never think about. Deep inside your pelvis sits a group of muscles called the pelvic floor. That sounds technical, but here's what it means. These muscles form a supportive layer beneath your bladder and bowel. They also help during urination, erections, and ejaculation. In many ways, they act like a supportive foundation underneath everything in the pelvis. Like any muscle in the body, they stay healthier when they remain active. During orgasm, these muscles contract repeatedly. Those contractions help maintain their strength over time. If sexual activity becomes less frequent, those muscles lose one source of regular exercise. This doesn't mean they suddenly become weak. It simply means they may not receive the same level of stimulation they once did. Some men begin noticing small changes. Perhaps they rush to the bathroom more often. Perhaps they notice a few drops of urine after finishing. Some experience a slight leak when they laugh, cough, or lift something heavy. These symptoms have many possible causes, especially as men get older. An enlarged prostate is common, and so are age-related muscle changes. But pelvic floor strength is one piece of the puzzle that deserves attention. The encouraging news is that these muscles respond to training. Just like strengthening your legs or your arms, the pelvic floor improves when you exercise it consistently. We'll talk more about those exercises later because they are simple, private, and surprisingly effective for many men. Now let's discuss hormones. Testosterone receives a lot of attention online, and unfortunately, much of the information is misleading. Testosterone is an important hormone because it influences sexual desire, muscle mass, bone strength, energy levels, mood, and many other functions throughout the body. Men naturally produce less testosterone as they grow older. That gradual decline is part of normal aging. Some studies suggest that regular sexual activity is associated with healthier hormonal function in many men, although the relationship is complex. Scientists believe overall health, physical activity, sleep quality, body weight, and chronic medical conditions also play major roles. What matters most for you is understanding this. A period without sexual activity does not automatically cause your testosterone to disappear. If your hormone levels begin falling enough to cause symptoms, your doctor looks at the whole picture instead of blaming one single cause. Many men tell me they feel more tired than they used to. They lose interest in intimacy. Their motivation drops. They assume age is the only explanation. Sometimes age contributes. Sometimes poor sleep, obesity, diabetes, depression, medications, or untreated hormone problems are involved. This is why guessing rarely helps. A proper medical evaluation gives much better answers than internet myths. As we continue, we'll look at the emotional side of sexual inactivity, how long-term changes affect confidence, what doctors usually check during an evaluation, practical ways to support your health, and the warning signs you should never ignore. Now that we've talked about what happens inside the body, let's look at something many men never expect. The physical changes are often easier to manage than the emotional ones. Over the years, I've met men who weren't worried about intimacy itself. They were worried about what the lack of intimacy meant. They wondered if they were becoming less masculine, less attractive, or somehow less healthy. Those thoughts often create more stress than the physical changes. Your brain plays a major role in sexual health. An erection does not depend only on blood vessels and hormones. Your brain, your emotions, your confidence, and even your stress level all work together. If one part of that system struggles, the others often feel the effects. When men go through a long period without intimacy, some begin thinking about sex less often. That doesn't always mean something is wrong. The brain responds to your daily routine. If intimacy is no longer part of that routine, sexual thoughts and desires sometimes become less frequent. This change is often gradual. For many men, desire returns once life circumstances improve, stress becomes more manageable, or intimacy becomes part of life again. That is one reason I encourage my patients not to panic if they notice temporary changes. I remember one gentleman in his early 60s who came to see me after losing his wife. Nearly 2 years had passed without intimacy, and he believed his sexual life was over. He expected me to tell him there was no hope. Instead, we evaluated his overall health, improved his blood pressure control, encouraged regular exercise, and addressed his anxiety. Several months later, he returned with a smile. His confidence had improved, and many of the symptoms that worried him had either improved or disappeared. His story is different from yours, but it shows an important lesson. The body often responds well when you care for your overall health. Research has consistently shown that sexual health is closely connected to general health. Men with healthy hearts, good blood sugar control, regular physical activity, quality sleep, and healthy body weight often have better erectile function than men with untreated medical conditions. That is because healthy blood vessels benefit every organ in the body, including the penis. This is why I tell patients that improving sexual health rarely starts in the bedroom. It usually starts with taking better care of the entire body. So what does a doctor usually check if you come into the clinic with these concerns? The first step is simply talking. I'll ask when you first noticed the change. Did it happen suddenly or slowly? Do you still wake up with erections? Are you taking any new medications? Do you have diabetes, high blood pressure, high cholesterol, or heart disease? Are you sleeping well? Have you been under unusual stress? These questions help identify the most likely cause. Next comes a physical examination. Your doctor may check your blood pressure, examine the genital area if needed, and look for signs that point toward hormone problems or circulation issues. Blood tests are sometimes recommended. Depending on your symptoms, these tests may include testosterone, blood sugar, cholesterol, thyroid function, and other routine health markers. The goal is not simply to treat symptoms. The goal is to understand why those symptoms appeared. Treatment depends on what we find. If poor circulation is contributing, improving heart health becomes a priority. If diabetes is poorly controlled, bringing blood sugar into a healthier range often improves sexual function. If testosterone levels are genuinely low and you have symptoms, your doctor may discuss whether testosterone replacement therapy is appropriate. This treatment is not suitable for every man, so careful evaluation is important before starting it. Some men benefit from medications designed to improve blood flow to the penis. Others improve with lifestyle changes alone. There is no single treatment that fits everyone. Now let's talk about practical habits you can start today. The first is regular physical activity. Walking, cycling, swimming, or any exercise that raises your heart rate helps improve circulation throughout the body. Strength training is also valuable because it supports muscle health, helps maintain a healthy weight, and contributes to normal hormone function. Even 30 minutes of movement on most days makes a meaningful difference over time. The second habit is practicing pelvic floor exercises. Many people know these as Kegel exercises. They strengthen the muscles that support the bladder and contribute to sexual function. A simple way to identify these muscles is to imagine stopping the flow of urine. Those are the muscles you want to gently tighten. Once you know where they are, practice contracting them for a few seconds, then relaxing completely. Avoid holding your breath while doing the exercise. Consistency matters more than intensity. The third habit is protecting your blood vessels. Smoking damages blood vessels throughout the body. Excess alcohol also affects sexual function in many men. Managing cholesterol, blood pressure, and blood sugar protects the circulation that healthy erections depend on. The fourth habit is getting enough sleep. During sleep, your body repairs tissues, balances hormones, and supports normal sexual function. Poor sleep over months or years affects much more than energy levels. The fifth habit is maintaining sexual function in whatever healthy way is appropriate for your situation. Whether intimacy involves a partner or masturbation, normal sexual activity helps maintain blood flow and tissue health. There is no medical reason for healthy men to feel ashamed of this. It is a normal part of human physiology. Before we finish, I want to mention a few warning signs. Please don't ignore a sudden inability to achieve any erection at all, especially if it happens unexpectedly. Seek medical attention if you develop pain during erections or ejaculation. Blood in the urine or semen should also be evaluated. Persistent difficulty with urination, severe pelvic pain, unexplained weight loss, or extreme fatigue deserve medical assessment as well. Remember, erectile dysfunction is sometimes one of the earliest signs of heart and blood vessel disease. Treating it as just getting older could delay the diagnosis of an important medical condition. The message I hope you take away today is simple. Going through a period without sexual activity does not mean your body is permanently damaged. Some temporary changes may occur. Many of those changes improve when overall health improves and sexual activity resumes. If symptoms persist, do not feel embarrassed about asking for help. Doctors discuss these concerns every day. You are not the first man to ask these questions, and you certainly won't be the last. Looking after your heart, staying active, eating a balanced diet, sleeping well, managing stress, and getting regular medical checkups all support your sexual health as you grow older. Small steps taken consistently often make a much bigger difference than people expect. Thank you for spending this time with me today. I hope this conversation has answered some of your questions and eased some of your concerns. This video is for educational purposes only and does not replace a consultation with a qualified doctor. If you found this discussion helpful and you enjoy simple, practical medical education explained in everyday language, please subscribe to the channel. I'm Dr. Ross, and I look forward to seeing you in the next video.